Welcome to the deep dive. Today, we're going deep on this one. Precancerous conditions of the colon and rectum.
Yeah,
We want to make sure you understand these conditions
absolutely.
clearly and concisely, and we're here to help with that. We've got medical definitions, risk factors.
Of course.
We've even got a fascinating case study in here
Oh, wow.
that will make you think twice about symptoms that you might not even think are related.
Yeah.
Okay, so let's unpack all of this. By the end of this deep dive, you'll understand what these conditions are, why they matter, and what you should be looking out for.
The fascinating thing is, these conditions aren't cancer yet, but they represent cellular changes
Right.
that could increase the risk down the line. That's why early detection is so important.
So let's start with the basics. What exactly does precancerous mean? I think a lot of people hear that word and they immediately think the worst.
It's understandable to be concerned. Precancerous means that the cells have started to change in ways that could eventually lead to cancer. Think of it like cracks in a bridge. They don't mean the bridge is about to collapse, but they do weaken its structure over time.
Uh-huh.
If those cracks are left unaddressed, they could eventually lead to a bigger problem.
So those cracks are essentially changes happening at the cellular level in our colon or rectum. And our sources talk a lot about adenomas. What are those and how do they fit into this crack in the bridge analogy?
Adenomas are polyps, which are abnormal growths in the lining of the colon or rectum.
Okay.
They're the most common type of precancerous condition in this area. And just like with cracks in a bridge, not all adenomas are created equal.
Right. The sources mention different types, tubular, villus, and tubulovillus. It sounds pretty technical. What's the difference and why should we care about that?
These names describe what the cells look like under a microscope. Tubular adenomas have cells that form tube-like structures and are the most common type. Villus adenomas, on the other hand, have cells that grow in finger-like projections. Then we have tubulovillus adenomas, which, as you might guess, have a mix of both tubular and villus features.
So you're saying not all polyps are created equal. Understanding these differences helps doctors determine the best course of action, whether it's removing a polyp during a colonoscopy or just monitoring it closely. That makes sense. Okay, let's talk about symptoms. Adenomas make themselves known, or are they silent troublemakers?
That's the tricky part. Most adenomas don't cause any noticeable symptoms, which is why regular screenings are so crucial.
Sneaky little things. But wait, our sources do list potential symptoms. Things like diarrhea, mucus in the stool, even rectal bleeding.
Right.
And then there's this case study that really caught my attention, a 78-year-old woman whose colorectal cancer actually presented as lower back pain and discitis.
Wow.
Discitis is an inflammation of the discs in your spine. It seems so unrelated.
That case is definitely unusual.
Yeah.
It highlights how interconnected our bodies are. While back pain and discitis are not typical symptoms of colorectal cancer, sometimes seemingly unrelated issues can actually point to a deeper problem.
Yeah.
It underscores the importance of listening to your body and seeking medical advice when something feels off, even if it doesn't seem directly related to your colon.
This case makes it clear why it's so important to be aware of any family history of colon problems, even if the symptoms seem unrelated. And that brings us to hereditary syndromes. Our sources mention a few, including Lynch syndrome and familial adenomatous polyposis, or FAP. What's important for our listener to know about these?
These syndromes are relatively rare, but they significantly increase the risk of developing colorectal cancer because of a mutated gene. Take FAP, for example.
Okay.
People with this syndrome can develop hundreds or even thousands of polyps in their colon and rectum. Imagine that.
Wow.
Thousands of potential cracks in our bridge analogy.
That sounds incredibly serious. What are the implications of having so many polyps?
With that many polyps, the risk of one or more becoming cancerous increases dramatically. People with FAP often need to start screenings at a much younger age and might even consider preventative surgery to remove their colon before cancer develops.
So if anyone listening has a family history of any of these syndromes, talking to their doctor is an absolute must.
Absolutely. Early detection is key in these cases. Knowing your family history and discussing any concerns with your doctor could make a huge difference. It could be life-saving.
It seems like knowledge really is power when it comes to these conditions. Speaking of knowledge, you mentioned earlier that a colonoscopy is the gold standard for detecting these precancerous changes. But what if someone is hesitant about that procedure? Are there any alternatives?
It's true. A lot of people are apprehensive about colonoscopies, and that's understandable.
Right.
While a colonoscopy is the most thorough method for examining the entire colon, there are other options.
Okay.
One is a flexible sigmoidoscopy.
How does a sigmoidoscopy compare to a colonoscopy, and what are the trade-offs to consider?
A sigmoidoscopy is similar to a colonoscopy, but it only examines the lower part of the colon. It's less invasive, but it also provides a more limited view. Another option is a fecal occult blood test, or FOBT. This test checks for hidden blood in the stool, which could be a sign of polyps or cancer.
So there are a few different screening options available, and each has its own pros and cons. I guess the best approach is to talk to your doctor and determine the most appropriate one based on your individual risk factors.
Exactly. A personalized approach to healthcare is always the best way to go. Now, going back to hereditary syndromes, our sources mentioned that genetic testing can play a role in diagnosis.
So who should consider genetic testing, and what kind of information can it provide?
Genetic testing is typically recommended for individuals with a strong family history of colorectal cancer or polyps, especially if those cancers were diagnosed at a young age.
So if someone knows their father or grandmother had colon cancer before the age of 50, for example,
Uh-huh.
that would be a red flag to talk to their doctor about genetic testing.
Yes, that's a perfect example. The test can identify specific gene mutations that are associated with an increased risk of developing colorectal cancer.
And I imagine knowing you carry one of these mutations can be empowering because it allows you to take proactive steps,
Yeah,
maybe increase surveillance or even preventative surgery.
absolutely. It's about taking control of your health.
You mentioned earlier the importance of listening to our bodies. What are some red flags that people should be aware of, signs that maybe it's time to see the doctor?
Certainly. Any persistent changes in bowel habits, such as diarrhea, constipation, or a change in stool consistency,
Okay.
should be investigated. Rectal bleeding is always a concern, as is unexplained abdominal pain or discomfort.
So don't dismiss those nagging symptoms. It's always better to be safe than sorry. Now let's talk about lifestyle. Our sources mention some factors that can actually influence colorectal cancer risk.
Yes, diet and exercise play a significant role. A diet high in red processed meats and low in fruits, vegetables, and fiber has been linked to an increased risk of colorectal cancer.
So loading up on fruits and veggies isn't just good for your overall health, it could be protecting your colon as well.
Exactly. And don't underestimate the power of physical activity. Regular exercise has been shown to reduce the risk of colorectal cancer as well as many other chronic diseases.
So we've got healthy diet, regular exercise, and being aware of our family history. What else can we do to minimize our risk?
Maintaining a healthy weight is important, as obesity is a risk factor for colorectal cancer. And if you smoke, quitting is one of the best things you can do for your overall health, including your colon health.
Right.
Alcohol consumption should also be moderate, as excessive alcohol intake has been linked to an increased risk.
It seems like a lot of these recommendations are things we already know we should be doing for our overall health.
Yeah,
They're good for our heart, they're good for managing diabetes, and it turns out they're good for our colon as well. It's all connected.
you're absolutely right. Taking care of your overall health is one of the best things you can do to prevent colorectal cancer. We've covered a lot in this deep dive.
We have.
We talked about precancerous conditions, explored risk factors and screening options, and now we've touched on lifestyle changes.
Yeah.
Any final thoughts for our listeners as we wrap up part one?
I think it's really encouraging to hear that there are things that we can control when it comes to our health in this way.
It is, and it's not just about individual action. There's also a systemic component to consider.
You mean things like access to healthcare and the availability of these screening programs that we've been talking about?
Exactly. Making sure everyone has access to affordable and quality healthcare, including those preventative screenings, is crucial in the fight against colorectal cancer.
That makes a lot of sense. Early detection is key, but it's only effective if people can actually access the tools for early detection.
Right. And we also need to do a better job of educating the public about the importance of screening in the first place. Many people are still unaware of the risks and symptoms we've talked about, or even that colorectal cancer screening is recommended starting at age 50 for average risk individuals.
So we need more public awareness campaigns, community outreach programs, maybe even incorporating this information into school health classes.
Absolutely. We need to make conversations about colon health normal and make sure people feel comfortable discussing these issues with their doctors.
You mentioned earlier that there's been significant progress in treatment for colorectal cancer.
Right.
What are some of the most promising advancements that are out there?
Surgical techniques have become less invasive, which means faster recovery times and fewer complications.
Okay.
Chemotherapy and radiation therapy have also become more targeted and effective, reducing side effects and improving outcomes. We're even seeing exciting developments in immunotherapy, which uses the body's own immune system to fight cancer cells.
That's incredible. So even if someone is diagnosed with colorectal cancer, there's still a lot of hope.
Absolutely.
There are effective treatments available, and research is constantly pushing the boundaries of what's possible.
Exactly. That's why staying informed and advocating for your own health are so important.
Well, we've covered a lot of ground in this first part of our deep dive.
Uh-huh.
We started with precancerous conditions, explored risk factors and screening options, and discussed advancements in treatment.
Yeah.
Do you have any final thoughts for our listener before we wrap up part one?
I'd encourage everyone to take this information to heart and have open and honest conversations with their healthcare providers.
Okay.
Don't be afraid to ask questions, express your concerns, and advocate for your well-being.
So it's all about being proactive, informed, and empowered when it comes to your colon health.
Exactly.
Awesome. Well, we will be back for part 2 of this deep dive. Until then, stay curious and stay healthy. All right, welcome back to the deep dive.
Part 2?
We're picking up right where we left off in part 1. We were talking all about colorectal cancer, the risk factors, the symptoms, and of course some of the screening procedures that are available.
Right.
In part 2, I want to talk about some of the things that we can do in terms of lifestyle that can help to mitigate our risk, and also some of the treatment options that are available.
Absolutely.
So let's dive right back in. You mentioned in part 1, the importance of maintaining a healthy weight.
Yes.
And we kind of touched on some of the dietary considerations, but, when you're talking about a healthy diet and exercise, well, what are some of the specifics that our listeners should be aware of?
Well, a diet that's high in fiber is really important.
Okay.
And that includes lots of fruits, vegetables, and whole grains. And then on the flip side, limiting red meat and processed meats.
So like bacon cheeseburgers?
Exactly.
Not good.
Not so good for colon health.
Okay.
And then, exercise is crucial. Aim for at least 30 minutes of moderate intensity exercise most days of the week.
Like a brisk walk.
Exactly. A brisk walk, swimming, cycling, anything that gets your heart rate up.
So we're talking about things that we've all heard before.
Yeah.
In terms of heart health. These recommendations are kind of across the board for just overall general health, right?
You're absolutely right. A lot of the things that are good for your heart are also good for your colon.
Now, one thing that we didn't touch on too much in part 1 was alcohol consumption.
Right.
Where does alcohol fall into all of this?
Moderate alcohol consumption is generally considered okay, but excessive drinking can increase your risk of colorectal cancer.
So moderation is key. What about smoking?
Smoking is definitely a risk factor for colorectal cancer, just as it is for many other types of cancer.
Okay, so it sounds like a lot of the things that we can do to prevent colorectal cancer are things that are really just good for our overall health and well-being.
Absolutely. It's all interconnected.
Now, let's shift gears a little bit and talk about treatment options. You mentioned earlier that there have been some significant advances in treatment for colorectal cancer in recent years. Can you elaborate on that a little bit?
Sure. One of the biggest advances has been in the area of minimally invasive surgery.
Okay.
This involves using smaller incisions and specialized instruments, which leads to faster recovery times, less pain, and fewer complications.
That sounds great.
It is. And then chemotherapy and radiation therapy have also become more targeted and effective. We're able to deliver higher doses of radiation to the tumor while minimizing damage to surrounding healthy tissue.
So you're basically saying that treatment has become more precise and more personalized?
Exactly. And of course, we're seeing some really promising developments in immunotherapy, which is a type of treatment that uses the body's own immune system to fight cancer.
That sounds incredibly futuristic.
It is. It's still a relatively new area of research, but it has the potential to revolutionize the way we treat cancer.
So even if someone is diagnosed with colorectal cancer, there's still a lot of hope.
Absolutely. The advancements in treatment have been remarkable, and there's reason to be optimistic.
Now, we've talked a lot about prevention, we've talked about treatment, but what about the emotional and psychological aspects of dealing with a diagnosis of colorectal cancer? That must be incredibly challenging.
It is. A cancer diagnosis can be very overwhelming, both for the patient and their loved ones.
Yeah.
It's important to remember that you're not alone. There are support groups, counseling services, and other resources available to help you cope with the emotional and practical challenges of cancer.
And of course, it's also crucial to have open and honest communication with your healthcare providers throughout the process, right?
Absolutely. Don't be afraid to ask questions, share your concerns, and advocate for your own needs.
Well, this has been an incredibly informative deep dive. We've covered a lot of ground here.
Yeah.
From understanding the risk factors and symptoms of colorectal cancer,
Right.
to exploring prevention strategies and treatment options.
Mm-hmm.
Any final thoughts for our listener before we wrap up part 2?
I just want to reiterate the importance of early detection. Regular screenings are the best way to catch colorectal cancer in its early stages, when it's most treatable. So talk to your doctor about what screenings are right for you, and don't put it off.
Welcome back to the deep dive. We're wrapping up our 3-part series on precancerous conditions of the colon and rectum.
It's been quite a journey.
It has, and I think we've gotten so much great information out there to our listeners. So much of it's about, empowering ourselves, right? Taking control of our health,
Being proactive.
making those lifestyle changes.
Mm-hmm.
But, as we talked about earlier, it's not always that simple, right? There are systemic factors at play.
Yes.
Access to healthcare, the cost of these screening procedures.
Exactly.
All of these things could be barriers for people.
They are, and they can prevent people from getting the care that they need.
So what can we do about that? I mean, how can we advocate for change? How can we make sure that everybody has access to the resources that they need to stay healthy?
Well, I think the first step is awareness.
Okay.
We need to keep talking about this.
Right.
We need to keep raising
Correct the
awareness.
stigma, right?
Exactly.
Make it okay to talk about colon health.
Yeah, it's not a glamorous topic, but it's an important one.
Absolutely. And, beyond awareness, I think we also need to put pressure on our elected officials to make sure that healthcare is affordable and accessible for everybody.
Absolutely.
Preventative care is so important.
It is.
And if people can't afford these screenings, they're not going to get them.
Right. Early detection is key.
Exactly. So what can our listeners do today? What's one concrete action that they can take to make a difference?
Talk to your doctor.
Okay.
Ask about your risk factors.
Uh-huh.
Get screened if you need to.
Right. And if you're experiencing any symptoms,
Don't ignore them.
absolutely. Speak up, advocate for your health. Knowledge is power. Right?
Yes,
And we've given you a lot of knowledge over these last 3 parts of the deep dive.
we have.
So use it wisely.
Please do. Your health is worth it.
Well, that brings us to the end of this 3-part series on precancerous conditions of the colon and rectum. We hope you found it informative, empowering, and maybe even a little bit inspiring. We want to thank you for joining us on the deep dive. Remember to stay curious, stay healthy, and we'll see you next time.